To start with, we need to ensure we get our fundamental understanding of post-activation potentiation correct. Therefore, the goal of this video is to present and discuss how different conditioning activity exercises can be implemented in training, testing, and competition for the enhancement of performances in different sports via post-activation performance enhancement and other delayed potentiation responses. The secondary goal is to differentiate between the two terms, that is post-activation potentiation, or PAP, and post-activation potentiation enhancement, which is represented by the acronym PAPE. The primary resource for this video is taken from the paper titled Post-Activation Performance Enhancement Strategies in Sport, a brief review for practitioners. The potentiation approaches covered here include warming up, testing and monitoring, re-warm-up and priming strategies, and complex training. The points discussed in this video will assist you with the foundational understanding for subsequent sections in this module, for subsequent chapters in this module. Historically, the most widely cited definition of post-activation potentiation, or PAP, is that proposed by Tillen and Bishop, in which PAP is defined as the phenomenon by which muscular performance characteristics are acutely enhanced as a result of their contractile history. This definition works well in most contexts. However, this is not an orthodox definition, as PAP would necessarily be related to a twitch verification test. In fact, most studies in sports have not been conducted with twitch verification tests, but with muscular power tests such as a vertical jump, promoting some misconception around potentiation responses. Therefore, for this reason, the term post-activation performance enhancement clearly differentiates between PAP and PAP enhancement. Both of these are induced by a voluntary conditioning activity. However, PAP enhancement refers only to performance enhancements in voluntary exercises. Meanwhile, PAP would refer to force increases during twitch verification tests. Despite this, it is common to simultaneously identify PAP and PAP enhancement after the same conditioning activity. As a result, when discussing studies with athletes in sport settings, PAP enhancement is the correct term. Post-activation performance enhancement should be considered one of the main objectives of warm-up protocols. This is separate to the physiological benefits derived from the rise of body temperature, enhanced neuromuscular, and cardiometabolic responses. The main mechanism related to potentiation has been suggested to be the phosphorylation of the regulatory light chain of myosin, which is a muscle memory mechanism that increases the sensitivity to calcium, favoring transient increments in peak force and rate of force development. Several other mechanisms have been proposed. However, as this video is focused on the practical aspects of PAP enhancement, we will present and discuss the PAP enhancement factors and their main moderators and the applications of PAP enhancement protocols. We will discuss the mechanisms in another chapter. During the last decade, several reviews and meta-analysis have provided a good approximation of the potentiation effects of different conditioning activities and of what parameters or moderators can be manipulated for achieving the desired acute potentiation responses in most scenarios. For example, to improve performance of power exercises such as jumps, sprints, and throws in well-trained strength or power athletes, a resistance exercise conditioning activity should include a protocol of 2 to 3 sets of up to 6 repetitions at a high intensity of greater than 70% of the athlete's 1RM. However, these conclusions should be taken with caution because of the heterogeneous study designs and sample characteristics that may limit the applicability of the finding in each specific sport setting. For example, whilst two meta-analyses suggest a moderate recovery time of 5 to 10 minutes for greater potentiation responses, Other studies have reported shorter potentiation responses in less than 5 minutes in both resistance and ballistic conditioning exercises. While both the exercise type and loading parameters are the most studied moderators of conditioning activities, there are continually evolving new strategies using different exercises and loading protocols. This is as indicated by the most widely used, such as the squat and ballistic exercises. New approaches have been demonstrated to be effective conditioning activities for PAP enhancement, including different eccentric overloads, elastic bands, and blood flow restriction cuffs, which further expands the possibilities from classic approaches. Meanwhile, the timing for implementation of the conditioning activities, that is, how the conditioning stimuli are distributed over time, is another moderator that has received less attention, and that may include both intra-session effort distribution as set configuration and delayed potentiation effects, as is commonly observed in team sports with re-warm-up and priming strategies. Interestingly, although there is a body of evidence suggesting an enhancement of power performances for up to 48 hours after a conditioning activity, it is not clear if this delayed potentiation has some physiological association with classic PAP and PAP enhancement mechanisms. Further studies are warranted to clarify these issues whilst looking for more efficient approaches in each sport setting, especially with respect to the application of potentiation approaches requiring the use of less implements. It is important to note that the type of target exercise to be potentiated, in other words, the verification test, and its associated performance parameters. Considerations that need to be considered in the enhancement of performance include factors such as cyclic versus acyclic exercises or power versus endurance exercises. Other considerations include the measurement variables, for example, peak or mean values that are collected during a counter movement jump. While the training age or strength levels have been systematically recognized as important moderators of PAP enhancement, it may be suggested that some of the generalizations from the literature may be biased by the potential influence of other, less studied moderators, such as age and sex of the athlete. Regarding sex, the findings in the literature are conflicting. As of yet, there are still only a few studies comparing sex differences, with some studies combining male and female athletes within the same study. These conflicting results may be due to the influence of other moderators, such as strength levels and age. The influence of hormones on myosin light chain phosphorylation should be taken into account. For this reason, identification of athletes' sex and age is recommended, apart from their specific sport. Furthermore, the physiological profile associated to the demands of each sport, for example, individual versus team sports or endurance versus power sports, can importantly influence both PAP enhancement factors and responses. But this moderator is not always considered, specifically in studies that have mixed athletes from different sports. The most widely used application of PAP strategies is the warm-up. A typical warm-up consists of brief submaximal exercises, such as 5 minutes of submaximal running at 50 to 60% of maximal heart rate. And this is to increase body temperature and metabolic responses before performing specific PAP enhancement strategies. Longer warm-up protocols, that is longer than 15 minutes, should be avoided as they can increase central and peripheral fatigue, therefore interfering with PAP enhancement responses. PAP enhancement is more often used to enhance performance in explosive or power exercises. Therefore, the athletes that would benefit the most from this strategy would be power athletes and sports that require sprinting, jumping, weightlifting, or dynamic movements. But paradoxically, studies with these populations are actually scarce. Most PAP enhancement studies have been conducted with recreational active subjects and team sport athletes, whose sport performances are not solely dependent on muscle power. This may be problematic for the applicability of most published approaches, reinforcing the suggestion of better characterizing the population of athletes. Endurance athletes could also benefit from inclusion of PAP enhancement strategies in their warm-up. But to date, there is limited evidence with these athlete populations. Of note, considering the transient duration of PAP enhancement, that is up to 10 minutes after a conditioning activity, one interesting potential is the use of pacing during the first splits of an endurance test to see the total effect on time. And this may be related potentially to the duration of the endurance exercise. Talking further on endurance exercise, aside from basic performance improvements, measurements of time to completion in these events, cardiometabolic responses such as oxygen uptake kinetics and perceptual responses may be other considerations to take into account as to whether a conditioning activity is successful. One less well understood of PAP enhancement refers to the work capacity during the subsequent exercises as a consequence of the augmented force capacity. Two recent studies have shown that high-intensity exercises in the warm-up enhance the total volume of a training session in the bench press and in the squat. For the bench press, they performed 3 reps at 90% of their 1RM, and in the back squat, they performed 2 reps at 90% of their 1RM. This reinforces the ability of PAP enhancement protocols to improve not only acute power performances, but also the total volume of the training session. And this potentially could be due to a better potentiation fatigue balance during the training session. While the use of PAP enhancement is not very problematic in training settings, the application in competitive settings is a lot more difficult because of the limited use of equipment and timing constraints. For this reason, it appears that ballistic exercises and other strategies based on easy-to-use equipment, such as elastic bands or blood flow restriction cuffs, may be attractive alternatives in competitive settings. For instance, a drop jump exercise could be easily implemented when dropping from a stair or a chair onto the floor, whilst an elastic band with a known load could be fixed to any bar or structure to perform several series of half squat exercises. In addition, other ergogenic approaches such as the incorporation of the concept called passive heat maintenance and the use of a passive heat maintenance garment or a jacket could be considered for the maintenance of elevated body temperature within an optimal range for performance. Remembering that for every degree of change in muscle temperature, you can have up to 4 to 8% change in power output. Therefore, a simple thing like maintaining muscle temperature and body heat could provide a great strategy for performance. The application of standardized PAP enhancement protocols with perfectly defined factors and moderators is important for repeatability and appropriate comparisons over time. Currently, there aren't any studies in literature clearly showing the evolution of PAP enhancement responses over a competitive season in well-trained athletes. The rationale for this stands on the recognized mediation role of training background and experience on PAP enhancement responses in both power and endurance athletes. The identification of an increased PAP enhancement after a training period would be an efficient strategy for detecting changes in fitness over the season, and as such, positive adaptations as a greater PAP enhancement would be concurrently related to enhancement of muscle potentiation and lowering of fatigue in response to the same stimuli. These positive physiological adaptations could be systemic and not only of neuromuscular origin. While this proposal is appealing, the only way to identify truer change is to perform randomized controlled studies according to the different sports. As a result, it might be suggested to use competitive exercises to better identify changes in fitness over the season, or simply to monitor changes in neuromuscular performances and other physiological measures during the same training exercises. One promising area of intervention and research refers to delayed potentiation responses. These are sometimes referred to as priming and re-warm-up strategies. Priming and re-warm-up strategies performed several hours, up to 48 hours beforehand, can improve high intensity and explosive performances. One recent systematic review and meta-analysis revealed that heavy resistance training and running-based sprinting exercises performed 4 to 6 hours before a competition were the best exercises to improve neuromuscular performance in the context of team sports demanding different locomotor activities. For instance, a brief morning warm-up, including some maximal short accelerations, may potentiate repeated accelerations during the game in the evening. As specific movement patterns performed under load appear to be more effective, other mechanisms than PAP may be involved. Hormonal status may be one such mechanism. Re-warm-up refers to strategies designed to maintain or recover the elevated body temperature and neuromuscular capacity of a previous warm-up. While body temperature could be passively maintained with heated garments, the use of PAP enhancement strategies would seem appropriate to increase muscle performance. This is especially important during hours of a competitive match in team sports. The use of heavy loads before lighter loads of biomechanical similarity is known as complex training. Recent reviews and meta-analysis have confirmed the long-term effectiveness of this approach for the enhancement of specific sport tasks, such as jumping and sprinting. However, there are several issues to be considered before implementation. For instance, while this training approach is theoretically based on an expected PAP enhancement effect of the heavy loads on the lighter loads of biomechanical similarity, it appears that these two assumptions are false, since firstly, there are no studies systematically reporting the PAP enhancement effects during each session of the examined interventions, and secondly, there is no evidence on the superiority of biomechanically similar exercises for PAP enhancement. Further, the use of complex training approaches does not seem to be better than the use of contrast training, which consists of performing first all the heavy loads and then subsequently the lighter loads towards the end of the session. This point is important as it suggests that the effectiveness of these approaches may be more based on the combination of different stimuli, independently of the order, than on the use of a single stimulus for training adaptations. From a practical point of view, when considering the need of a sufficient recovery time for the purported PAP enhancement and the necessity of individualized interventions, the use of complex training may not seem to be as time efficient and would be very difficult to be implemented in sports settings with lots of athletes. Therefore, until future studies confirm the necessity of PAP enhancement responses during complex training interventions for achieving greater improvements in the long term, there isn't sufficient evidence to prefer complex training over contrast training or the use of different training stimuli over different days. Generalization about potentiation responses is not possible if we consider complex interactions among PAP enhancement factors and their moderators. Individualization is therefore a key point when translating research results to the real world on the track, on the field, or in the gym. That is, after identifying the specific literature, it is important to check with the athlete if the individual responses agree with the expectations based upon the literature. For this reason, the paper spoke about a new taxonomy which could be very helpful to identify the best conditioning activity, taking into account the verification tests and the specific population of the athletes, which are the main factors modulating PAP enhancement. As discussed in the article, this new taxonomy has not been used in previous literature because it has only been recently published. Therefore, you want to make sure that you carefully check the correct identification of the PAP enhancement factors in all the articles that you read for the purposes that you give to your athletes. And this is not always possible given the poor characterization of athletes in some of these studies that we read. As an example, if we are training a group of well-trained male middle distance runners, we may be interested in a simple and effective conditioning exercise to rapidly induce PAP enhancement before an 800-meter competition. Therefore, any PAP enhancement protocol without the need of complex setting and with a rapid effect would be preferred over other PAP enhancement protocols. Studies have shown evidence of different ballistic exercises on running economy and performance of endurance athletes. From these studies, it would seem that the best option would be the use of a set of 5 drop jumps, looking at reactive strength index 6 minutes before competition, as this is the only option that has been shown to improve 1,000-meter performance and also pacing performance in another study of a similar population of elite male runners. As an S&C coach, the ideal method from this point would be to take the literature and identify if this protocol could be modified to be more time efficient and at a lower physical cost to the athlete. Using that previous example, we could see if only 3 drop jumps and only 3 minutes before the competition would provide a similar or even better performance outcome. Another example here in studies that looked at male soccer players who wanted to optimally prepare themselves when performing a change of direction test during a training session. When looking at previous studies, they have highlighted different conditioning activities, such as using flywheel exercises, weights vests, and half squats, used to increase the performance in very different change of direction tests. Initially, you may look at trialing the weights vest, as you may have one already. If you have success with this intervention, it may be the only PAP enhancement activity that you do. There are other interesting mix of different approaches when looking for a greater PAP enhancement effect. For instance, using a resistance exercise methodology called the French contrast method, which involves combining different resistance and jumping exercise. This has been shown to result in greater jump potentiation than a single conditioning activity in one study. However, attention should be taken to the summatory effect of both potentiation and fatigue when performing the French contrast method, and we'll be covering that one later on in this module. In summary, we have briefly highlighted the current evidence on PAP enhancement factors, conditioning activities, verification tests, and the population of athletes, and their potential moderators, such as exercise type and loading, timing, recovery interval, target exercise, performance parameter, training background, age, and sex, as well as other delayed potentiation strategies, such as priming and re-warm-up exercises for their use during training, testing, and competition. The consideration of the PAP enhancement factors is a thorough method to help better identify the best protocols in the literature for our specific purposes to implement it in the field on an individual basis.